Guys, I'm so glad that we're getting to work on this video together. It's just that I've been so anxious about this project. What if we don't get the video done or the professor thinks I'm not doing enough for my part? This is gonna ruin my grade. Maybe even get me kicked out of the program. I just know something bad's gonna happen.
Whoa, 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 Michael. That sounds like a lot of worrying for this one project.
Is this a common feeling for you, Michael? Do you worry a lot about a lot of things?
Yeah, this happens to me with most of our assignments. I've been really anxious since we started school last year. Really worried that I won't succeed and that I can't really control the thoughts. I've been feeling on edge and irritable, and I've not been sleeping well since.
Hmm. So what you're experiencing is a diagnosis called generalized anxiety disorder, or GAD. It's when people worry excessively about everyday situations, often out of proportion to what's actually happening.
Exactly. And GAD affects around 3% of the US adult population each year, and 6% are impacted at some point in their life. Women are diagnosed at nearly twice the rate of men. The symptoms usually start in adolescence or early adulthood and often persist for years if untreated, though the intensity and the content of the worries vary.
Yeah, I've read about that. It's considered a chronic condition, but there are two main paths for treatment: psychotherapy and medication. And CBT is the first line and gold standard for psychotherapy.
So let's break that down. Cognitive behavioral therapy, or CBT, which is the most widely researched treatment for GAD, works by identifying maladaptive thought patterns and behaviors, then replacing them with healthier ones. There are a lot of theories about what causes this disorder, but they all include these three elements. One, for people with GAD, worrying is a strategy to avoid unpleasant internal experiences. Two, while it may work in the short term, it stops people from learning that they can survive this discomfort. And three, both positive beliefs, worrying prevents bad things, and negative beliefs, my worrying will never end, lead to this disorder.
Some common CBT tools for GAD include psychoeducation, where we as therapists teach clients what anxiety is, how it works, why it persists, and if relevant, we also inform them about any other symptoms affecting their lives.
That makes sense. The psychoeducation part alone would help reduce fear when people realize anxiety symptoms aren't dangerous. They will feel more control.
Right. And there's also cognitive reappraisal. This is a technique that challenges these maladaptive thoughts and then reframes them. We could try it right now with you. It seems like you're stuck in a thought that's catastrophizing. I'll fail out because of one video.
So, with this technique, we might start by asking about the evidence for that thought.
Okay, how about I have to complete this video to pass the course?
Okay, that's valid. Is there any evidence against that thought?
Well, one project wouldn't cause me to fail the whole program. Also, I've always kept up with my work before and done well. Also, it's just like 15% of the whole grade for the class, I guess.
Exactly. So, what would be a more balanced thought?
Hmm. Maybe it would be that it's important for me to do well in the video. And I also know that it's only 15% of my total grade, so either way, I'll be fine.
Perfect. There's also several third wave CBT approaches like DBT, ACT, and others, and many of them incorporate mindfulness.
Oh, I actually wrote my paper on mindfulness integrated CBT. It combines CBT with mindfulness techniques to help people stay grounded in the present instead of worrying of what ifs.
Yes. Clinicians can guide clients in mindfulness exercises, guided imagery, progressive muscle relaxations. For example, when you get really worried, Michael, you could do a DBT skill around paced breathing, where you breathe in for a count of 4, hold for a count of 6, and exhale for a count of 8.
Also, the good news is that CBT is consistently shown to be highly effective for GAD. Research shows that around 50% of clients experience significant improvement with CBT, and many maintain these gains long term.
In fact, CBT is found to be significantly more effective than both pharmacotherapy alone, and stress education. Cognitive reappraisal, the technique we just used with you, Michael, is particularly effective in reducing worry. And mindfulness based CBT has been shown to improve emotional regulation and reduce relapse rates.
That's amazing. Plus, it's also structured and relatively short term treatment, which makes it practical for clients and providers. But CBT can also be adapted for long term treatments if it needs to happen.
Yes, and the truth is, CBT isn't perfect. Some people don't respond fully, especially if they have severe or treatment resistant GAD.
One reason might be because it's not clear which CBT will be most effective. For each specific client, each person's unique, which is a challenge given to since there's so many techniques available.
Right. And it also requires active participation in practice, which not every client is ready for. Another limitation is access. Not everyone can find a trained CBT therapist. And therapy, as we know, can be expensive. Research also shows that clinicians enhance effectiveness, so that's especially concerning.
Also, unfortunately, there's not enough research on treatment efficacy for historically underrepresented or oppressed groups, which is, again, particularly concerning since experiencing racism can increase rates of GAD, and LGBTQ plus populations are more frequently diagnosed with GAD than the general public.
The advantages are big, though. It's evidence based, it teaches lifelong coping skills, and it doesn't rely on medication alone. It could be, though, but that's when it's integrated. Plus, clients feel often empowered because they learn tools that they can use outside of therapy.
Michael, how are you feeling now?
Yeah, I'm still feeling a little bit nervous about the video, but I don't feel doomed. That's a big step forward.
For sure. And this was an example of how CBT techniques like cognitive restructuring can help manage anxiety in the moment.
And how understanding GAD's course, treatment, and prognosis can reduce stigma and give people hope.
100%. Such a big step forward. Even though CBT doesn't erase anxiety completely, it gives you skills to manage it so it doesn't control you.